Welcome to Vision Impairment and Mental Health. Introduction and Learning Objectives. Most of us have experienced a loss that had a profound and lasting impact on our life, such as the death of a loved one or a pet, or the loss of a home, job, or friendship. Think of a situation in your own life. How did you feel? Maybe sad, angry, anxious, helpless. Someone who is losing their vision experiences these same types of strong emotions. People react to and grieve loss of vision and the loss of life as they know it in the same way they do other losses. And, like all of us, sometimes need help from others to deal with a difficult life change. In this program, we'll talk about ways that losing vision affects people's lives, and we'll describe the types of services and strategies that can help them cope. A better understanding of this will help improve your interactions with people who are visually impaired and enable you to better inform others about important resources. After today's program, we hope you'll be able to describe the emotional, functional, psychological, and social impacts of vision impairment, and describe how behavioral health services and supports help people cope with losing vision. The impact of vision impairment. Vision is something most of us expect to always have, and it plays a huge role in our quality of life. Many people delay recognizing the need to speak with a doctor about changes to their vision, assuming the impairment is a natural sign of aging or that nothing can be done. When it's given, a diagnosis of vision impairment has a severe effect on most people. Losing your sight is losing a part of yourself. It changes your identity as part of the sighted world. You become a person with vision impairment. And unlike some other types of disabilities, vision impairment is often not recognized or obvious to other people, so the severity of its impact can be misunderstood or minimized. While every person's experience and feelings are unique, and everyone deals with vision loss in their own way, there are common emotional, functional, psychological, and social impacts that people may experience in varying degrees and combinations. Emotional impact. Whether vision loss is sudden or gradual, emotional adjustment is hard and can be overwhelming. In early stages, people may experience changing vision, but then block it from their mind and don't mention it to others, often out of fear. When faced with a diagnosis of a condition that causes vision impairment, many people experience catastrophic anxiety and dread. They may fear becoming blind. They may become withdrawn and sometimes bitter and angry and question, why is this happening to me? They worry, how will I take care of myself? What is my life going to be like? Letting go of the past and facing fears about the future is a lot to handle. The road to acceptance can be a long one. These feelings are natural. They can occur in different degrees and combinations for each person and may surface at different times and come back in cycles. For example, each time a person's vision gets worse, they may have the same emotions as when their vision loss first started. Functional impact. When people are losing vision, their life may seem to become restricted. Their ability to perform basic skills and daily activities changes. It may be difficult to recognize friends' faces, shop and cook for their family, read and write to pay bills, and carry out personal hygiene tasks such as styling hair, putting on makeup, or shaving. They may knock food off the plate when eating, stumble or bump into things they don't see, and be unaware of stains on clothes. Imagine how this might feel. People, understandably, can become frustrated at not being able to do things as quickly, as well, or as independently as before. They may feel helpless, self-conscious, or worry about being embarrassed. How will you play cards when you can't read the cards? or play the piano if you can't see the keys? How will you continue in your job or stay in touch with family members online if you can't see the computer screen? It is not surprising that withdrawal from people and activities, social isolation, and loneliness are common. Psychological impact. Vision impairment can have a negative impact on mental health. Anxiety and depression are common. Studies have found that people with vision impairment are 2 to 3 times more likely to be depressed than those with normal vision. Further, a study conducted at Lighthouse Guild showed that people who have eye conditions with a poor prognosis, such as diabetic retinopathy or retinitis pigmentosa, had higher rates of depression than those with reversible or more treatable causes of vision impairment. Feelings of distress, anger, low mood, and anxiety affect how a person feels, thinks, and behaves. Common symptoms of anxiety include trouble controlling worry, trouble focusing, trouble sleeping, feeling restless, wound up, or on edge, and being irritable. Prolonged anxiety, left untreated, can develop into depression, exhibited by loss of interest in hobbies, often feeling sad or anxious, feeling helpless or worthless, appetite and or weight changes, fatigue or low energy even after sleeping well, or thinking life is not worth living. Further, there is a bidirectional relationship between vision loss and mental health, meaning that vision loss can worsen symptoms for people who are already dealing with mental health issues, such as anxiety and depression. In turn, depression can worsen vision impairment, as some people are less likely to seek medical care for conditions that impact vision, such as diabetes, or adhere to treatments and lifestyle modifications that can stall the progression of vision loss, such as daily eye drops to control glaucoma. Social impact. Changes in self-concept, in how people see themselves and how they think others see them, often happen with vision loss. Their role in day-to-day life and how they contribute to their families and households may change. They may be moving from a position of solely providing care to a position of very often having to receive help. This can be jarring. Adjusting to the change in balance of giving and receiving affects the person's identity. Each life stage also presents specific issues and challenges that influence how vision loss impacts someone's life. For example, a person who lives alone in their own home might not be able to drive or travel alone anymore and must ask for help to go anywhere. A parent may not be able to bring their children to and from school by themselves anymore. Those who are employed may struggle with tasks at work and worry about losing their job. Middle-aged adults may be the primary caregiver of an aging parent and are no longer able to provide that care. And for older adults, coping with vision impairment may be complicated by other changes that come with aging, such as the loss of loved ones, other disabilities and health problems, and increased dependency. In short, vision impairment makes it more difficult to do things, to take part in social activities, and to get around. It can make people not want to leave their home or even panic over the idea of leaving home. For people of all ages, this can increase isolation and feelings of helplessness, inadequacy, loneliness, and depression. Let's hear one client, Muriel, describe how vision impairment impacted her life.
My name is Muriel, and I've had poor vision in my left eye since I was a child due to amblyopia that could not be corrected surgically. No help was offered other than glasses that never really helped me. I learned to live with it as they told me to. I went on to become a nurse and get married. In my 60s, I survived breast cancer. I thought cancer would be the worst thing that ever happened to me. But after retiring, I developed macular degeneration in my right eye. This was horrible. I was essentially blind in my left eye, and now everything was distorted and blurry in my right eye. I went to the best doctors I knew. They all said, "There's no treatment for dry macular degeneration. I'm sorry, there's nothing we can do." I spent a year searching for doctors as my sight deteriorated rapidly, but I kept being told there is nothing we can do. It got to a point where I could no longer read my mail or medication labels. I couldn't recognize my friends' faces. I was afraid to cross the street or leave the house alone, and I burned myself cooking. We stopped traveling. The vision in my right eye became so bad that I was relying on my left, the bad eye, for my vision. I was blind, depressed, isolated, and felt abandoned by my doctors. I became completely dependent on my husband for everything, and this caused tremendous stress in our relationship. But I was so lucky to have him. I stopped going to doctors.
Strategies and services. As we've shown, diagnosis of vision impairment can be a shock. Adjusting to vision loss, accepting a new life reality, and moving forward is a challenging journey for many people. Many don't receive the emotional support they need. Some people, especially those later in life, are unaware that they're having mental health struggles. Others are just not aware of what is available to help them. Behavioral health professionals lead people to understand that their life is not over, but it may be different. They offer strategies and resources for making informed decisions, setting goals, and making positive changes. Some strategies that can help people cope with vision impairment include: educate themselves about their condition and available services and support. Organize their space so items are easy to locate and it is easy to navigate. Create a positive inner dialogue. Visualize how their life can improve and surround themselves with positive people. Set goals and take steps forward, no matter how small. Become familiar with assistive technologies that allow them to continue doing favorite activities, such as learning the accessibility features on smartphones or finding theaters that offer audio description services. And lastly, seek professional guidance from behavioral health specialists and low vision specialists. Professional services can help people cope with vision loss, many of which are increasingly offered online, virtually, as telesupport. Individual therapy. Talking with a mental health professional is important to determine if someone is clinically depressed and to help them deal with their symptoms and develop healthy coping skills and behaviors. Speaking with a professional in a supportive environment allows people to be vulnerable and emotional in ways that can be difficult, even around close family and friends, and helps them draw upon their inner strength. Family counseling. Families are the biggest support system. Counseling helps address marital and financial problems and relieve conflicts within the family. It allows family members to express how the person's vision impairment affects them and learn how to best help them. Family members naturally want to help their loved ones, but too much help can make them overly dependent. Studies show that people with families that support them in being as independent as possible have greater psychological well-being. Group therapy and support groups. Talking about their loss with others going through the same thing can help people see they are not alone, learn how others are coping, and see different solutions to their problems. Plus, meeting other people that are in the same place and understand your situation can lead to friendships and other support systems that offer socialization opportunities and reduce social isolation. Vision rehabilitation. Training to help the person learn new ways to accomplish tasks despite decreasing vision will help them stay independent and can bolster confidence and self-esteem. Among many examples, this may include using a low vision device, such as a magnifier, getting mobility training to learn navigation techniques, possibly using a white cane and assistive devices, technologies, and apps for reading and object identification. There is no generic formula for the perfect support system. Some people find personal psychotherapy or counseling sessions with a trained professional more beneficial, while others find strength in hearing from people with similar experiences. Some people find value in a balanced approach using one-on-one sessions as well as attending support groups. Let's hear from Muriel again, describing how comprehensive low vision services helped her to adjust and resume her active lifestyle.
The low vision doctor showed me very strong magnifiers that helped me read large print, a CCTV that enlarged normal print so I could read the newspaper, and a telescope so I could see street and crosswalk signs. This all changed my life. I was no longer dependent on my husband for everything. I felt empowered and, for the first time, hopeful. The doctor registered me with the Commission for the Blind and arranged for orientation and mobility training, where I learned to use a sight cane, and now I can travel alone. A support group and counselors helped me deal with blindness and recognize I wasn't alone. After years of training and counseling for my vision loss, I wanted to help others who suffered as I did. It took 5 years, but at the age of 80, I earned a certificate in social work from Fordham University. It was one of the greatest accomplishments of my life. I realized that being blind didn't mean my life was over. I had a new beginning. Thank you for listening.
Final thoughts. Today, we talked about the many ways vision impairment can impact people's lives and reviewed strategies and services that can help them cope. We hope this information will help you to better understand what people with vision loss are going through and to educate others about vision impairment and the benefits of behavioral health services. Thank you.